It's now 8:19, and this morning on today's health cancer screenings, we've all heard that early detection is the key, and that means undergoing a variety of tests to screen for cancers. But now some experts suggest that things may not be so cut and dry. For most women over 40, it's a routine part of health care. The American Cancer Society recommends a mammogram every year to test for breast cancer. But at 56 years old, Jean Lenzer doesn't want one.
My doctor was quite upset with me when I told her I was declining mammography. And she actually suggested to me that she couldn't have me as a patient if I wasn't going to, help myself.
She spent years scouring medical reports as an investigative reporter and has come to the conclusion that early detection won't help her live any longer.
Everybody has to make their own choice. And for me, as a healthy woman, without having a family history, I just don't feel that it's proven.
The thinking goes back to a 2005 study in the Journal of the National Cancer Institute, which essentially says that all breast cancers detected from a mammogram aren't equal. Some could be life-threatening, while others may pose no risk at all. Either way, both types are often treated aggressively.
I figured, for me personally, it just wasn't right for me.
That fear of unnecessary treatment isn't limited to mammogram patients. Increasingly, questions are being raised about the benefits of other forms of cancer detection, such as colonoscopy for colon cancer. And just this week, a study in the Journal of the National Cancer Institute found that the common PSA prostate test may lead to overdiagnosis. Still, some doctors would rather be safe than sorry.
Screening is imperfect. We need to continue screening. We have to recognize the limitations of screening.
A continuing debate that's raising even more questions for patients concerned about their long-term health. Reader's Digest tackles the controversial issue in its April issue, and Dr. H. Gilbert Welch is a professor of medicine at Dartmouth Medical School and author of Should I Be Tested for Cancer? Maybe Not, and Here's Why. Dr. Nancy Snyderman, of course, is NBC's chief medical editor. Good morning to both of you.
Hi, Matt.
Good morning.
I have to tell you, I was reading this last night, and I'm thinking, tomorrow morning I'm going to go on the air and I'm going to tell people that everything we have told them for the past 10 years, 12 years that I've done this show may be thrown out the window, and I don't know if I'm comfortable doing that. Doctor?
Well, I'm not sure I'm comfortable doing it either. It is a complex problem, Matt. When Nancy and I went to medical school, we were trained that when we heard the word cancer, it meant a disease that if we didn't treat it, it would grow and invariably kill the patient. But as we start to look for early forms of cancer, we realize that cancer is a much more complex and varied disease than that. Yes, there are cancers that grow very fast and kill patients, but there are also cancers that grow so slowly that they never even appear before the patient has already died from something else. And they're cancers that, in fact, regress. They get smaller.
But here's my problem with this. If we do a cancer screening test and we find out about any of those cancers early on, then it's really beholden us to treat it correctly. But why walk away from the screening?
Well, the problem is that doctors can't distinguish between those cancers that are actually going to go on to kill people and those cancers that are indolent and not going to cause problems. That's the problem of overdiagnosis. We see all these cancers and we don't know which ones are going to matter.
We have the technology to find lots of little things that we couldn't even have found 20 years ago. And we've been taught that the earlier you find something, the more I can cure you. Now we're really starting to say, wait a minute, is that true? Have we been asking the right questions? Because it's not, can we find cancer and can we treat you? The question we have to ask is, are we changing cure rates? Will you live longer?
And I hate to make it a numbers game, Nancy, but I'm wondering,
it is a numbers
are
game.
More people going to die if they resist the early detection and the early screenings than who are going to ever die from aggressive treatment that perhaps wasn't necessary?
Well, this is where we might differ, because I think you have to sort of look at this and say, okay, I recognize there is no routine testing at the age of 35 for everything. I have cancer of the colon in my family. I happen to believe that mine is a genetic hit. So I have started my colonoscopies at an earlier age than maybe Gil would have. But for me, because I know that runs in my family, that's my early detection.
Let me go real quickly here.
Yeah.
Doctor, should I not get my yearly PSA test?
Matt, I think that's a really personal question that for you to really be informed about would take me, an hour, half hour to really talk to you about the pros and cons of PSA testing. The fact is, though, we don't know yet whether PSA testing actually saves any lives.
A finger in the rectum, feeling the prostate is still one of the best tests for checking cancer of the prostate.
I'm going to ask that we do more segments on this because I want to
Okay.
spend more and more time with it. But one thing I do want to leave people with is you both agree, I believe, Pap smear is a crucial test.
Phenomenal success rate between 1955 and 1970. I disagree. Between 1955 and 1992, 74% increase in lives saved. I think the Pap smear is an unparalleled success.
I think the Pap smear has done some good. I'll just show you, and we agree on the numbers. There's been a dramatic drop in cervical cancer deaths. So has there been a dramatic drop in stomach cancer deaths. Same size, nothing to do with early detection. So cancer is a complex issue. It's not
Absolutely.
just...
Let's
it's
leave
not
people
just
with this.
doctors. Yeah.
Spend a lot of time talking to your individual physician about these
Absolutely.
tests.
The only thing I want to add, though, is this is a very hard thing for an individual physician to get done in 10 minutes or 15 minutes. You know, you need to read about it. That's why Shannon wrote the article. That's why I wrote a book. If you want to understand it, you need to read about it.
Dr. H. Gilbert Welch and Dr. Nancy Snyderman is a controversial idea. Thanks very much.